Hello everyone. So a warm welcome to this class. This is again a continuation of yesterday's class. It's equally important because we'll be doing something very, very important which will help you not only in diagnosis but also treatment through acupressure. So let us do a short prayer and then we'll start the class. We'll take a short, deep breath in and exhale. Another deep breath in and exhale. Again, deep breath in and exhale. Remembering our parents and gurus, receiving their energy. We start today's class. Okay, so we were doing arthritis as the topic, and it's a very important topic because we'll get many patients who come to you with this problem, this particular problem, though they'll not say it directly that we are suffering from arthritis, but the patient will come to you and say, I'm having joint pain. Now you are the one who will diagnose what type of joint pain is that. Is this because of arthritis? Is this because of some type of cramp or spasm or some traumatic changes or injury? What is there in the joint? Okay, so yesterday we started with this and we understood that there are different types of, first we understood what is a joint, then we discussed about what are the different types of joints. What are the different types of joints according to the type of movement present in the joint? What are the changes in the joint that leads to arthritis? And what are the different types of arthritis? So this is what we have already done. So while discussing about arthritis, we discussed about gout. We also discussed about osteoarthritis. Okay. So when we discussed about a very quick revision of what we did under arthritis, when we discussed about gout, we understood that gout is because of, now type fast in the chat box, gout is because of high level of dash in the body, high level of, I think this will help you in waking up too. High level of, okay, first is Madhulika ji to answer. Uric acid in the body. Uric acid is found in the joint in the form of dash. In the form of crystals. Very good. What is the shape of the crystal? Ajit ji has already answered. The shape of the crystal is Kirti ji. Very good. Needle-like. Okay. Which part of the body shows the deposition of these crystals as a first symptom? Which big toe? Right big toe. Yes, Madhurika ji. Right big toe. Okay. What is the swelling on the joints called when the uric acid deposits for long period of time? What is that called? You give it to the kids and they love it. It's not tophi, it's tophi. T-O-P-H-I. Okay. Tophi. Yes, T-O-P-H-I. Correct. So the swelling is tophi, which appears. When uric acid will increase in the body pH will increase or decrease? Very good. Decrease. Yes, kid. Why increase? Increase is alkaline. Na? If it becomes more than 7, it is alkaline. If it becomes less than 7, it is acidic. So it decreases. Body pH decreases. Which gender will show more uric acid, increase in uric acid more? Male or female? More frequency in males. Okay. So these are some of the things which we will see. Which test will show you the presence of gout or gout-like arthritic changes in the body? Which test will confirm? No, it's not X-ray. If you doubt, yes, blood test, but what type of blood test? Uric acid. Okay, so we'll ask the patient to go for uric acid blood test. CRP may be high, but uric acid will confirm that it is gouty changes, gout-like changes are there in the body. Okay. So this is about uric acid. Now come to next type of arthritic changes, and that is osteoarthritis. Osteoarthritis is what type of arthritis? What type of arthritis it is? Very good, Neetaji. Degenerative. So it is, no, all the type of arthritic changes are on bone only, Kirtiji. So we'll not say it's a bone related problem. All arthritis are related to joints. So joint is nothing but fusion of two bones, the connection of two bones. Okay. So when we talk about osteoarthritis, it is a degenerative change. That means it is because of age. So it is age related arthritis. Okay. More the dash, more the arthritic changes you will see. More what? Very good. Weight. More the weight, more arthritic changes you will see. And also maybe because of age, but weight has direct connection. Age does not have a direct connection, because you may get people who are 80, 90, but no arthritis. But if more weight is there, definitely there would be some joint related ailments, because joint is the area which is bearing the weight of the body. Okay, especially the major big joints, for example, knee, hip, all these joints get affected if there is more weight. Okay. So this is about osteoarthritis and about gouty arthritis. Now we come to the next type of arthritis, which is also very, very, yes, X-ray report is very important. Yes, correct. So the test which shows, you have already given the answer to the question which I have not asked only. So what type of test will confirm it is osteoarthritis? It is definitely X-ray that will show that there are arthritic, osteoarthritic or age-related arthritic changes in the body. Okay. Now we come to the next type of arthritis, which is also very important arthritis, and it is in the book it is mentioned as rheumatic arthritis. See, there's a difference between rheumatoid arthritis and rheumatic arthritis. So in the book it is written as rheumatic arthritis. Actually, it is a type of arthritis. First listen, if you listen carefully, then automatically everything will seep in. It is a type of arthritis which is because of some type of, it's a very, very special type of arthritis, because it is not an arthritis which is directly affecting the joints. It's an arthritis which actually starts from the throat. How surprising. Arthritis that starts from throat. So it's a streptococcal infection, what we call a strepto infection. So infection in the throat, which is recurrent. Again and again, someone is having throat infection. That throat infection in due course of time, which is very frequently seen in small kids, 5 to 15 years of age or similar kind of age, when they are having continuous infection in the throat, and after few weeks, maybe 15 days or after 30 days, then that infection leads to fever. This is so interesting. So that period, 15 days or 30 days time period, is actually the incubation period for the bacteria to grow in the body. Okay. So the streptobacteria actually attacks the immune system. When it attacks the immune system, what immune system has to do? Immune system has to protect the body. But instead of protecting the body, this immune system gets faulty. This is interesting. This immune system gets faulty, and instead of protecting the body, it affects the healthy cells of the body, and that causes fever. Okay. And in due course of time, maybe 10 years, 15 years, 20 years, it may affect the heart as well. So if someone comes to you with the problem of rheumatic heart disease, you ask the patient, did you ever have some type of throat infection which was maybe acute, which stayed for long period of time, that caused fever, high fever? So the person says, most of the time the person answers in affirmation and says, yes, I had, when I was very small, I had fever, recurrent throat infection. So that throat infection, the streptococcal infection, actually leads to infection in the heart, and it may lead to infection and changes. Yes, tonsillitis, because throat infection at times, strepto infection affects the tonsils also. Okay, so this type of infection which shows as major changes in heart also may cause change in the valve. It may change the rhythm of the heart. So this type of infection is very important to be noticed and taken care of. Don't ignore throat infection, because when we ignore throat infection, you can understand now this may lead to a disease maybe after 20 years of age, after 20 years. Okay, so this, what to remember and understand this in this type of rheumatic rheumatic heart disease. Yes, this is the major cause of rheumatic heart disease, major cause of rheumatic arthritis. So rheumatic heart disease showing symptoms as rheumatic arthritis. Okay, so in this type of arthritis, what we discussed as the main cause of this type of arthritis is streptococcal infection in the throat. So this infection in the throat leads to fever after. Now remember one more thing, nowhere it is mentioned that if someone is having streptococcal infection, the person will have rheumatic heart disease. If you take care of the infection, if you cure the ailment in due course of time, in due time, then this is not going to harm the body in future. But if it is neglected, if someone is having streptococcal infection again and again, recurrent episodes are there, then ultimately this affects the bigger organs of the body, important organs of the body. So our fever appears after 2 to 4 weeks of time. The cause may be faulty immune reaction. Okay, so what may be the symptoms of this type of rheumatic? It's not rheumatoid, it is rheumatic. So for this type of rheumatic arthritis, the major symptom is red, hot, swollen joints. Second, very, very important point to be remembered, and you can just mark it as very important, is the pain in one joint migrates to another. Migrates to another. So if the person may complain that one day the pain is in this particular joint, another day it is in different joint. So it is a moving pain from one joint to the other. Mostly knee, ankle, elbow, wrist. That means the big joints are affected. In this type of rheumatic fever, where the bacteria is causing the infection, streptobacteria is causing the infection, in maybe after few years, the effect is on heart. If the effect is on heart, heart also shows some type of changes. For example, heart may show changes in the valve. So what would be the change in the valve? It may show stenosis. Stenosis means narrowing of heart valve. Narrowing, narrowing of heart valve. Mostly it is seen that mitral valve is affected, bicuspid or mitral valve is affected, but at times other valve may be affected as well. Okay, so this is, you can imagine the impact of this bacteria on the body. So it is affecting the heart. It may also affect by changing the movement of blood, circulation of blood through the heart, and that is affects circulation through heart. So this is called regurgitation. Regurgitation means backflow of blood in the heart. Also, heart muscles may be affected. Okay. So now we can understand the severity of the this type of infection, septo infection in the body. How will you diagnose? What are the different pathological reports that will show that, okay, this is the type of problem? In case, if you get any pathological report done, then you will see that WBC is high, neutrophil is high, ESR is high, RBC goes low. Also, C-reactive protein is high. So all are high except for RBC. RBC goes down. RBC report shows lesser number than expected. So this is about rheumatic arthritis. Okay. Now we come to another type of arthritis where the name is similar but the cause is different, and it is rheumatoid arthritis. What is rheumatoid arthritis and how will you understand that it is rheumatoid arthritis? See, understand this, that rheumatoid arthritis is an autoimmune disorder. It's not immune disorder, it is autoimmune disorder. What is the meaning of autoimmune? Immunity means the type of ability of the body to protect itself from different pathological factors, external and internal. If the pathological factors are attacking the body and your body is protecting you from them, but instead of protecting, it harms itself, then it is called autoimmune. That means self-killing. Okay. So this type of immune system, where the immune system is harming itself, harming the body itself, then it is called autoimmune disorder. It's a big topic. We are not going into the detail of what autoimmune disorder is, but just understand autoimmune disorder means immunity where it is not helping the body, but but harming the body. That is autoimmune disorder. Okay. So here in this case, rheumatoid arthritis, it is autoimmune disorder. And how will you understand that it is autoimmune disorder? Because usually it is seen in families. It passes on in family. If someone in the family suffers from rheumatoid arthritis, usually it is seen that other person or other family member, maybe little distantly related, but may have rheumatoid arthritis. Second important way of diagnosing it is You have seen osteoarthritic changes are seen in big joints, right? You have seen uric acid gouty arthritis is seen in big joints. Even your rheumatic arthritis is seen in big joints. But in case of rheumatoid arthritis, it starts from small joints. So it starts from small joints and it goes to the bigger joint. For example, if it starts from the phalangeal joints, it starts from the phalangeal joints. Usually it starts from the, this is carpal. These are carpals, these are metacarpals, and these are phalanges. So metacarpophalangeal joints. So what are metacarpophalangeal joints? So if this is metacarpal and these are phalanges, so the joints here are called metacarpophalangeal joints. So it is seen that rheumatoid arthritis actually starts from these joints. Okay, and affects the smaller joints. Then it moves on to the bigger joint. Maybe it affects the wrist. Then it goes up. It affects the elbow. It goes up. It affects the shoulder. From the toes, it affects the ankle. It goes to the knee. It goes to the hip. So it is moving on to the bigger joint. If someone says that I was having problem first in the small joints, in the fingers, in the toes, it was becoming stiff. Now I am having problem in the ankle or wrist or knee or elbow or hip or shoulder. Then you can guess, it's a guesswork. We are guessing that it may be, you'll never say it is, because you don't have the proof to say that it is rheumatoid arthritis, but it may be a case of rheumatoid arthritis. I'll show you how these joints look like. Just a minute, I'll show you two pictures. So these are metacarpophalangeal joint, the green area. So this area is metacarpophalangeal joint. Okay. This is a very nice picture where you can see the joint very clearly. So this is one bone. This is another bone. And you can see the in-between tissue, the protective tissue on the joint. Okay. Now this protective tissue here shows, this area shows inflammation. So inflammation is swelling, warmth, redness, pain. So these are the conditions that will appear at a particular area. So this whole area is showing this type of problem. Okay. So this may be a case of rheumatoid arthritis. Fine. But another important characteristic of this type of arthritis, rheumatoid arthritis, is it not only affects the small joints which are moving on to the bigger joint, but it also affects major organs of the body. That's a sad part of this type of arthritis. And that is why the life expectancy of the patient also reduces. It affects the life of a patient majorly. So what is this rheumatoid arthritis? Rheumatoid arthritis is the arthritis where the cause is autoimmunity. It affects the small joints, moves on to bigger joints. It is seen in family. So it passes on from one person to the other in the family. Not only the joints, but it also affects other organs. How come? For example, if it affects heart, if a patient suffers from rheumatoid arthritis, the patient may have problem in the heart. This is very, very important. How heart is affected? It may show hardening and blocking of arteries. So the arteries are becoming hard in this case. See, this is if you don't have the knowledge of these types of arthritis, rheumatoid arthritis, what is rheumatoid arthritis? What is causing this rheumatoid arthritis? What are the different symptoms of rheumatoid arthritis? How are you going to use EOV, EAV, Chinese, or TCM or Ayurvedic points to treat? If a patient comes to you and says that I'm having joint problem, also there is some problem in the heart. I don't know what the problem is, but there is some problem in the heart. If you have no knowledge of rheumatoid arthritis, will you be able to ask relevant questions to the organ? So definitely understanding a disease is very, very important. So hardening of, it says that hardening of arteries and vessels, muscles of the heart are becoming tough. What type of EAV meridian you can choose to treat that? What type of, which meridian will you choose to treat? Which EAV meridian will you can choose to treat that type of degeneration? Okay, joint degeneration, because it is related to arthritis. I'm talking about a patient who is suffering from heart ailment because of rheumatoid arthritis. AD, yes, very good. AD, see, organ is always there because organ is affected. But organ, remember, organ is deep lymph. Organ is not lymph. Organ is deep lymph. So deep lymph, usually we choose where it is, lymph is affected. Lymph of an organ is highly impacted. Here we are talking about hardening of vessels. So there must be some specific character of that particular meridian which is treating it. So allergy degeneration is a vessel. It's a meridian that treats hardening of vessels. Okay. So AD is very important. You can choose AD to treat that particular ailment along with joint degeneration, JD. Okay. So we were talking about the organ getting affected because of rheumatoid arthritis. So hardening of arteries are seen in case of heart. Also, it may affect lungs. At times, you will get to see that there is scarring, SCARRING, scarring of lung. There is inflammation in lung. The patient complains of shortness of breath. Now, what is causing all these problems? Just listening to the fact, just listening to the complaint of the patient that I am having shortness of breath, and the patient is suffering from rheumatoid arthritis. What we start doing? We start treating the shortness of breath by giving the point. But do you think shortness of breath is the problem here? What is the root cause here? Rheumatoid arthritis is the problem. Okay. We are really blessed and we are really thankful to the teachers, to the gurus who are giving us this knowledge, precious knowledge rather. I'll discuss about a patient with you who came with psoriasis all over the body. Yes, I have the picture, but I'll take little time to show it to you. Maybe next week I'll show you the picture once I take it out. Her body is not a single area on the body is there except for face, which is not affected by that type of psoriasis. So whole body is affected. And the skin is thick as crocodile skin. And she complained, when she came to the chamber for the first time, she said that she did not complain about psoriasis, which was so severe. She said, my problem is I'm having severe joint pain. And I'm unable to sit or stand also because of this joint pain. After understanding, after diagnosing the whole of the problem, when I was going into the detail of the subject, I saw that in one of the books, Khemka sir has even written about joint pain because of psoriasis. So this is the type of detail the gurus have given us. What is needed is, one is diagnosis, and second is finding out the right protocol for the right person. Okay. So after maybe 5 or 6 sittings only, we were using that particular protocol for the lady only. And after 5 or 6 sittings, her psoriasis reduced a lot, maybe 60 or to 70% it reduced. And she was much better in her flexibility and in her movement. Only with those points, because it says very clearly, so joint pain because of psoriasis. Okay. So whenever a patient complains of a particular problem, you understand what the root cause is. For example, if a patient is saying shortness of breath, but also complains that I have rheumatoid arthritis, then what will you treat? You have to choose. Now you should have that wisdom. Which one to choose? You should choose the rheumatoid arthritis, or you should choose shortness of breath. You will choose definitely rheumatoid arthritis, because this is the one which is affecting lung also. Right? RA is the thing that you will choose to treat. Okay. So ask for wisdom. Don't ask for intelligence. Ask for wisdom that will help you in understanding your patient. Another part of the body which is also affected severely because of rheumatoid arthritis is eyes. So patient with rheumatoid arthritis may complain of dry eyes. So if patient with arthritis has dry eyes, will not treat dry eyes, will choose rheumatoid arthritis. Okay. Mouth. Dry mouth. Patient says, my mouth gets dry very frequently. Carpal tunnel syndrome. Carpal tunnel syndrome. What is carpal tunnel syndrome? You go through, you search on internet. This is your homework for today. Search for what is carpal tunnel syndrome, what causes carpal tunnel syndrome, and what are the areas of the body, of the arm rather, that shows the symptoms of this particular pain. Okay. See the picture. You will understand which part of the arm is getting affected in this. So in case of carpal tunnel syndrome, which is because of compression of a certain nerve, in case of rheumatoid arthritis, this may be one of the symptoms. But if a patient, yes, it is around the wrist bone, but it is not actually around the wrist bone. This is the homework, what you have to do. Which part of the palm shows the effect of carpal tunnel syndrome? So if a patient is coming to you, she or he says that I'm having carpal tunnel syndrome. And in modern medicine, apart from surgery, there's no other way to treat carpal tunnel syndrome. Okay. So if the patient says that I'm having carpal tunnel syndrome, and we start looking for the protocol of carpal tunnel syndrome, there is very good protocol of carpal tunnel syndrome. But she says that I'm also having the rheumatoid arthritis. Then we need to treat rheumatoid arthritis instead of treating only carpal tunnel syndrome, because rheumatoid arthritis is the type of arthritis which compresses the nerve passing through the wrist. So because of inflammation of the wrist, the nerve is also getting compressed, and it is giving the symptom of carpal tunnel syndrome. Okay. So carpal tunnel syndrome, the nerve gets compressed. Why this nerve is getting compressed? Maybe because of some external pressure which was falling on the wrist continuously. For example, those who work on laptop, keyboard continuously, their wrist is continuously on the surface. It is getting pressed. So they complain of carpal tunnel syndrome. If the sleeping posture is not correct, at times what people do is they sleep on the wrist. So this nerve may get compressed. Maybe because of some type of rigorous exercise a patient is doing every day, where the wrist is getting a lot of pressure. Then also it may show the symptom of carpal tunnel syndrome. Also rheumatoid arthritis, which is giving swelling and inflammation in the wrist area also, is compressing the nerve there and is giving the symptom of carpal tunnel syndrome. Then we'll treat rheumatoid arthritis instead of treating carpal tunnel syndrome. It will automatically reduce the effect of carpal tunnel syndrome. Okay. What are the symptoms? What are the symptoms of rheumatoid arthritis? First of all, as we said, it affects the small joints first. This is very important. Number two, then it spreads to bigger joints. For example, from fingers, it will move up to the shoulder area. From the toes, it will move up to the hip area. Number three, this is also very important point, that whichever joint is affected, it affects both sides. That means bilaterally the joint is affected. So if left side is affected, then right side is also affected. So you will find the pain to be on both sides of the body, same joint. Fine. So these are some of the very important symptoms of rheumatoid arthritis. What are the tests that will show rheumatoid arthritis? One is RA. RA factor would be high. It will show RA factor positive. Another one is WBC would be high. ESR would be high. And albumin, which is a protein, goes low. It reduces. C-reactive protein is, usually it is normal. Okay. And the patient complains of morning stiffness. So when the patient is waking up in the morning, the patient says that my joints are very painful and stiff, red, swollen, painful. Gradually, the pain decreases, but it stays almost the whole day. Okay. So this is about rheumatoid arthritis. Now there is another type of arthritis. Surprisingly, this is another type of arthritis which is not very frequently talked about, but it also exists, and it is this is the last type of arthritis, which is tubercular arthritis. So what is tubercular arthritis? Tubercular arthritis, from the word only you can make out it somewhere it may be related to tuberculosis, right? So what is the causal agent for tuberculosis? What causes tuberculosis? What causes tuberculosis? Is it because of external pathogen or internal pathogen? E for external, I for internal. Something within the body is happening or something from outside. Okay, immunity. Okay. Tuberculosis is very good, Rituji. This is actually external pathogen. And what is the external pathogen here? It is because of bacteria. Okay, it is because of a type of bacteria. So the name of the bacteria is Mycobacterium tuberculum. Is the name of the bacteria. This type of bacteria which affects the body and causes this contagious disease. Contagious means it may pass from one person to the other. If someone comes in contact with a person who is suffering from tuberculosis, may get this disease through food, through water, through touch, through clothes, through sharing the same bed or sharing the same utensils in which the person is having the food. It may pass on from one person to another. So this contagious disease, which is affecting a certain part of the body, mostly it affects lungs, but it may affect other part of the body also. So wherever the body part is getting affected, if that part is not treated on time, see again, being aware of your body is very important. Whether you are aware of the body or not, your body speaks to you. Do you know that? Do you know the language of the birds? How to understand what they are saying? Do you understand what animals talk about? What they are talking to you? You cannot make out. Do you know how your body talks to you? Yes, you know, because you know acupressure. So again, we are blessed. Lot of gratitude to the teachers, to the gurus who are giving us this precious knowledge, because it teaches us how to understand what your body talks about through different symptoms, that it shows whether it is on hair, on your face, on your eyes, on your tongue, on your posture, through your complexion, whatever it is. So this is how the body talks to you, that this is what is happening in my body. Okay. And if you get the symptom, if you get the signal, and if you ignore it, here ignorance is not bliss, because this ignorance is leading to some major ailment in the body. Same with tubercular arthritis, because if the tuberculosis is giving you the symptom that this is what is happening in the body and you ignore the disease, then this bacteria, which is localized for the time being, passes through bloodstream, passes through lymph to bone. So tuberculosis, which is localized at a particular organ, goes to the bones and affects the bone. Then it is called skeletal tuberculosis. Okay. So if the bone is affected, then in long run, the joints also may get affected, and that is called joint tuberculosis or arthritis due to tuberculosis or tubercular arthritis. What happens in this tubercular arthritis? In tubercular arthritis, see, it is not in one day that the joints are getting affected. Tuberculosis itself is, do you know the time period for which tuberculosis is treated? How long the treatment continues for tuberculosis? If it is modern medicine, the patient has to take treatment for how long? Almost a year. Actually, 9 months duration is mentioned, but you can take it as 1 year. So you can understand a disease which takes 1 year to get cured. Do you think it will show the symptom on the bone or on the joint in 1 day? No. It will take a long time to show erosion in the joints. What happens in the joints? The joints are eaten up because of this type of tuberculosis. So this is not a very common type of tuberculosis, very less seen, but it is one of the oldest disease mentioned in the medical history. So it is at places it is mentioned that it is also mentioned in the mummies. They suffered from tubercular arthritis. So in the Egyptian era also, this is the type of disease which is mentioned. So not so very common, but a very, very old disease where the joints are eaten up by the bacteria. What happens in the joint? I'll show you one picture. It's a very beautiful picture, but it will tell you a lot of things about what happens if the bone is eaten up. See, this is a normal bone. This is a normal bone. Okay. This picture is very important. The one which I've marked as double marked, double ticked. Osteoclast cells are the cells which causes eating up of bone. That means whenever a bone is about to die, or your body does not need a bone, or the bone is old enough, then osteoclast cells are the cells that will kill the bone or dissolve the bone. Okay. And other type of cells which helps in regeneration or new building up of the bone are osteoblast. So one is C, one is B. Osteoclast will help in resorption. What is the meaning of resorption? It's not reabsorption, it is resorption. Resorption means dissolution. That means dissolves the bone. And what is happening? What helps in formation of the bone? Osteoblast cells. But if osteoclast cells are more, that means heavier in comparison to osteoblast cells, which are lesser in number, then what would be the result? More of resorption and less bone formation. Is this clear to everyone? If there is more bone resorption, less bone formation, then this will lead to osteoporotic bone. That means the bone is dying, you can. Okay. So trabecular number decreases, trabecular thickness decreases, trabecular spacing increases, cortical thinning takes place. That means the topmost part of the bone, which is called the spongy bone. This spongy bone is called the trabeculae. Okay. So this trabeculae starts eroding. That means dying or finishing up. Ultimately, it may show more fractures because the bone is dying, bone is degenerating very fast. But what is causing all these changes? It is the bacteria here. Okay. So I'll show you one more picture that is also quite interesting. Okay, this is another picture where it shows what is trabeculae. This is trabecular or the spongy bone. So this part of the bone, the topmost part of the bone, is called the trabecular or the spongy bone. Okay, this is a continuation of the bone. This is another picture which is also this is tubercular arthritis or tuberculous arthritis, which is seen usually in the hips or knee or also in ankle. Insidious onset. What is the meaning of insidious? Insidious. Insidious means gradual, but painful. Not in one day. It's a gradual thing, but it's a very painful and degenerative. That is insidious. So it's insidious onset of arthritis. It is not in one day. Gradual, slowly, it's eating up the bone. So you can see the lot of erosion is there. It's eaten up. Here also it's eaten up. See, it's eaten up in these areas. And you can see a lot of erosion and degeneration in the hip area also. So this is about tubercular arthritis. So what was the learning out of this arthritis chapter? The arthritis chapter talks about different types of arthritis. First one is gouty arthritis. Gouty arthritis is because of uric acid. Uric acid crystals may be present not only on joints, but it may be present in kidney. If the uric acid crystals are present in kidney in excess amount, it may turn into kidney stone. Okay. So if someone is having frequent kidney stone, for example, check the uric acid level also. If the patient complains of high uric acid and also complains of kidney stone, then treat uric acid also. Because even if the kidney stone comes out and the uric acid level is high, it will again lead to formation of kidney stone. So treat kidney stone, treat uric acid in that case. These uric acid crystals may also get accumulated. We are just revising what we did, all the 5 types of arthritis. So first type, uric acid or gouty arthritis, the crystals of uric acid at times you will see. I'll show you one picture because this is a very interesting picture which you will, many times you must have come across this type of ear where some whitish stone-like small structures are present in the ear in different areas, not necessarily in this helix area only, and helix and antihelix, but Maybe here, you will see some crystals, white crystal-like things are present. So these are nothing but a uric acid crystals. Check for uric acid level in these patients. So gouty arthritis, in case of gouty arthritis, we need to treat the uric acid. In case of osteoarthritis, pain management is, weight management is very important, and along with that, calcium level is very important. So treat calcium, treat weight of the patient. Also the activity and lifestyle is very important in case of osteoarthritis. If it is rheumatic arthritis, then you need to check whether the patient had strepto infection in throat in past or not. But along with that, you need to treat the joints. Okay. If it is rheumatoid arthritis, it is autoimmune disorder. So in case of autoimmune disorder, always treat the emotions of the patient also, because something is disturbing the patient continuously. Something is disturbing the patient continuously, and patient thinks about, a patient feels guilty for some reasons. It may cause autoimmune disorder. So check the emotions also, work on emotions of the patient also, along with the different organs which may be affected. So check whether heart is affected, check whether lung is affected, dry eyes are there, mouth is dry, or carpal tunnel syndrome is there, whatever we discussed about, check those symptoms also. In case of rheumatoid arthritis, tubercular arthritis is rare type of arthritis. I don't think very frequently you will get a case of tubercular arthritis, but if you know about tubercular arthritis, at least you are aware that this type of arthritis exists. Okay. So in that case, we'll treat the bacteria or the infection of the body. So this is all about arthritis, different types of arthritis, symptoms of arthritis, diagnosis and treatment. This was all for today. आप लोग करिए, देखिए patients को देखिए and treat more cases, and gradually you will understand what may be the different type of arthritic changes in the body. Okay. Thank you so much, everyone.